talk about basics part 2, navigating the healthcare system and understanding how the healthcare system works here in the United States. This is Dr. Kurt Reyes, also known as Tubby Doc, hosting a series of basics of healthcare. I made this mainly because I noticed some of the 20 to 30-year-old patients who are taking control of their insurance and getting to know the healthcare system often found themselves confused. So hopefully this will help those who need it. So let's talk about the definition of a physician. So those of you who are listening to YouTube, you're on Reels, there's people who carry this title doctor. So in the clinical setting, doctor should be or is reserved for people who graduated medical school. In the United States, that usually means they have a medical degree, so an MD or a doctor of osteopathy. Here in the US, after our names, we have MD, that's Mike Delta, or MD for medical doctor, or doctor of osteopathy, DO. Those are your classic doctor or physician that you think about. In the state of Texas, physician is legally, this is a summary and not a quote of the Texas code. Physician is someone who actually graduates from medical school. So what about these other doctors? There are other doctors. For example, to make it even more confusing, there's a doctor of optometry, and they legally can carry the title doctor. And so they're the ones who usually prescribe and examine your eyes for your glasses and contacts. And then there's ophthalmology, and those are medical doctors or doctors of osteopathy who went and got training for eye care. And so they're the experts of the eyeballs, and they're the ones who will do more advanced procedures. There's some crossover between the two, and I know there's a turf war between those two professions, but in general, there is a difference. It's appropriate to call an optometrist doctor. I'll tell you some other things that are kind of not as appropriate or can be even more confusing. Physical therapists don't often refer themselves as doctor, even though they do have a doctorate degree. So there's a level within the world of academia and college where you can carry or you earn the title doctor. And one of those might be a PhD. You can have a PhD in philosophy, and in the university, you carry the title doctor. But in the clinical setting, you really should not be using that title because it confuses people. Matter of fact, there's some people on YouTube who have their title doctor, and when you look at what their credentials are, they're actually not even in medical care, but they put their medical advice up. Anyone nowadays can shoot a video and put it on YouTube, Instagram, or whatever, and give you medical advice, but you have to verify that source, and you want to know. Now, sometimes some of that advice can be very good, even if it's what we call unprofessional advice, or that they've done a lot of research, and sometimes that insight is very good. But when you have the lens of someone who's been trained or educated in medical school, gone through residency, we have a different lens than someone else who does research who's a PhD in biology. So even though someone may have a PhD in biology, doesn't necessarily mean they have the same perspective as a medical doctor, because they're not trained how we're trained. They're trained differently, right? So you got to look at that as when you're getting to know healthcare professionals. You go to urgent care. A lot of urgent cares now are not staffed by physicians, they're staffed by nurse practitioners. And so nurse practitioners are RNs who get additional training, and now they created a degree called a doctorate of nurse practitioners. So some of them will try to carry the title of doctor. Very confusing. And so when you're talking to a healthcare professional who's taking care of you in that moment, it is perfectly okay to ask them what kind of physician or non-physician or nurse practitioner they are. And if they say, yes, I'm a physician, that should mean, oh, you're an MD or DO. Yes, they should answer that. Or they say, well, I'm a doctor, but I'm a doctor of nurse practitioner. That's fine. Chiropractors are also have a doctorate of chiropractor. So you see at the end of their name, DCs, or a doctor of chiropractor. So just keep that in mind if you're receiving advice. Who are you receiving it from? Everyone has an opinion, but how much do you put weight into their opinion if they're the wrong specialty? For example, I'm internal medicine and obesity medicine, and if you ask me what's my thought on the most recent procedure for a neurosurgical intervention, I'll be like, I don't know, because that's not my specialty. I'm a physician, they're a surgeon, they're a physician. Shouldn't I know that? No, because we're that specialized. Physicians, for the most part, know that we know our limitations, and we'll be very honest about it. What I found is other professions may not be as honest with you about it, and you should ask. So whenever you're meeting with someone for your personal health, you just want to know what their credentials are, okay? Because you may be under the impression that you're meeting with a physician, but you're really not. And that's no knock on any of them. It's just the reality is I want you to understand how to scrutinize and how to verify people's credentials and the weight of advice. So keep that in mind, that if you're new to the healthcare system, not everyone's a physician nowadays. It's very confusing, and it's just a reality of, I won't get into why that's happening. That's the reality. Understand who you're talking to, look at the paperwork, and if you have to seek another opinion, go seek another opinion. Sometimes it's best to get two physician opinions. If you disagree, like you met one of the experts, let's say you met me and I made a call about your blood pressure, but you didn't agree. Okay, let's go get you another opinion somewhere else. It's not going to hurt my feelings, and you shouldn't be really hurting anyone else's feelings if they're really objecting to you requesting their credential. That's actually a red flag in my book if someone becomes very offended that you asked them what their credentials are. It's part of our profession to let the patient know, so they can have full informed consent who is guiding your care at that moment. I hope that helps. I'll see you at the next episode of the Basics of Healthcare. Dr. Reyes, Tubby Doc, out.